starting to sound like a broken record. We've been talking about it feels like every day now, but the message still needs to be heard if you ask doctors. A tripledemic of COVID-19, the flu, and RSV, it is pummeling our healthcare system right now after several years of pandemic burnout. Hospital beds are running out nationwide. They're opening up mobile units in some states. RSV in particular hitting pediatric hospitals. 8 states and Washington, D.C. reporting at least 90% capacity in their pediatric hospitals, the majority facing flu-like illnesses as well. Officials in Georgia are now sounding the alarm, warning RSV and COVID-19 could send more patients packed into these overflowing hospital and emergency departments. New York State is now reporting its first pediatric flu death as well. So we've got a lot to talk about here. Joining me now to discuss it is Dr. Saju Matthew. He is a primary care physician and public health specialist in Atlanta. Doctor, good morning to you. Thank you. Lazy optimism is something you say we need to avoid when it comes to these illnesses. What do you mean?
Yeah, Marni, I'll tell you what, you said it appropriately in the lead-in, and the fact that people are tired of physicians like me standing here talking about getting vaccinated. A lot of people think that just because you can't see or smell COVID-19, that it's miraculously gone away. We talk a lot about the endemic phase of this pandemic. That's when the virus is not going to cause a lot of large outbreaks consistently all over the world. That's a good thing. But the problem is, even an endemic virus like COVID-19 can cause clusters of outbreaks, death, and disease. So what I mean by lazy optimism is the fact that we can't will this virus away, not wear a mask, not get vaccinated, and think that COVID-19 has just disappeared. I was just in Mexico this last week. I probably was one of 10 people on a congested plane from Atlanta heading to Mexico that was wearing a mask. And I've always said this, Marni, once you remove a mask mandate, it is very difficult to bring it back. So guess what? It's in the hands of people like you and me. If we can just take control of the fact that we need to wear a mask in congested spaces, obviously get vaccinated and wash your hands, not only can we decrease getting COVID-19, but also the other respiratory illnesses like RSV and influenza.
What's the flu vaccine this year? Is it a good match for the strain that's going around?
I'm so happy to report that it is, because a lot of times every year we play that whole guessing game, and that's the only choice that scientists have, is to make an educated guess of which strain might affect which particular geographic area. But this year, yes, the CDC and the scientists got it right. All the more reason why you want to get vaccinated. And one last point regarding the flu is the fact that I have a lot of patients who are catching the flu left and right, but a good number of my patients are vaccinated and their illness is not as severe. So despite the flu vaccine, even if you get the flu, you will have a much milder illness, and it's not too late to get vaccinated. The flu season can go all the way through May of the calendar year.
And a lot of people that were lining up in the early days of the pandemic, doctor, wanted the vaccine against COVID, but we're seeing a lot of hesitancy, a lot of laxed approach in getting the booster. Why is the booster that's out now important, and how is it different than the shot that people already have?
If you walk into any pharmacy in the United States, the booster shot will include a vaccine that protects you against Omicron. And Omicron and its cousins are the circulating viruses currently in the US and in many parts of the world. So what you want to do is you want to get an updated vaccine. It's like getting an upgraded iPhone. You want to get an upgraded vaccine that not only protects against the old variants, but certainly against the newer variants. And what we're also seeing from studies is that this new Omicron vaccine, what it does is it definitely attacks the Omicron variants and its cousins, as I mentioned. And so it also decreases the number of infections. And if you can decrease the infection, you can decrease people going into hospitals. Is also one reason why you want to get this updated booster shot.
Yeah, good message. Listen, I had COVID over the summer. I don't want it again, and I was vaccinated. So if it was worse without the vaccine, no thank you. Dr. Saju Matthew, primary care physician, public health specialist, thank you for your messaging this morning. There is a vaccine for a lot of this stuff. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.